Mr. Speaker, as Evelyn Forget, University of Manitoba health economist, reports, under the NDP, Manitobans with low incomes have a declining health status. This is reflected in the Ds Manitoba received in today's Conference Board report on life expectancy and the incidence of disease. The poor health support in Manitoba, shown by Ds and accessibility and continuity of care, are contributing to the poor health status of low-income Manitobans. I ask the Minister of Health, will she commit today to take new measures in the next 6 months to reverse the growing and appalling trend of a gap in health care received by the 20% of low-income Manitobans compared to the rest of Manitoba?
Thank you very much, Mr. Speaker. We know that the Conference Board of Canada report is very clear across Canada about the great disparity that exists in health status between the wealthy and the poor. We know it is very, very clear that there is a great gap in health status between Aboriginal and non-Aboriginal Manitobans. We're very committed to doing everything that we can to reduce that gap by bringing services on reserve like dialysis in Island Lake and in Barons River, by applying the Healthy Baby program to all babies in Manitoba, and ensuring that we're providing all Manitobans with access to a family physician with a very aggressive target of 2015. Certainly, I concede the point that the member is making about this gap in health status, and it's a shared responsibility. We all have to work together on this.
Time has expired.
As Professor Forget has pointed out, April 23rd in Calgary, there's this appalling and growing gap in healthcare and healthcare status between low-income Manitobans and the rest of Manitoba.
Right.
You know, as one example, rates of Pap tests for women are sadly dropping for the 20% of women with the lowest socioeconomic status. This government has failed dismally in ensuring that those who are the most vulnerable get adequate preventive health care. I ask the Minister to tell this legislature what specific measures is she taking to increase the proportion of all women who receive a Pap test at the recommended frequency, but particularly those on low income.
Thank you very much, and I thank the member for the question. I believe the member knows that a project underway in Manitoba, the PIN project, the Physician Integrated Network, is a critically important project for primary care taking place all across Manitoba. We know that the supports that we've offered through the PIN project on electronic medical records have helped prompt the family doctors in ensuring that they're providing more Pap tests. We've seen as a result of the PIN project a dramatic increase in the number of Pap tests performed. We believe as this particular measure rolls out among all of our family physicians, the ones we're committed to providing to all Manitobans by 2015, will indeed dramatically increase that, and the member is right to ask this good question.
Well, I'm pleased the Minister acknowledged the appallingly low results at the moment and the very poor results on the Conference Board report. Professor Forget also highlighted that the lowest income earners in Winnipeg have 10 times the rates of tuberculosis, 4 times the rates of suicide and attempted suicide, 2.5 times the rates of amputation for diabetes, and twice the underage 5 mortality rate compared to the rest of Winnipeg and Manitoba. These figures are atrocious. I ask the Minister of Health, what specific measures are she and her government taking to reverse these appalling trends and the low Conference Board marks which have occurred during the last 13.5 years of NDP government?
Yes, thank you very much, Mr. Speaker. Well, again, I can say to the member the greatest commitment that we're making is continuing to invest in healthcare, regardless of global economic circumstances. I would say to the member, I find his line of questioning, while important, curious, strange, that it would come from the member that sat at the cabinet table while withdrawing health and social transfer payments. We know that during that time, Mr. Speaker,
The Honourable Minister of Health to continue her answer.
Yes, very simply, Mr. Speaker, Manitoba's infant mortality rate actually got worse in the 1990s. While the member for River Heights was cutting health payments, while the Tories had their hand on the wheel, the rate was, in 1991, 8.4%. Today, the rate is down nearly 40%. At 5.2, we've got more work to do, but honestly, these lectures, really,